but we're never taught about sexual health. We're never taught about pleasure. We're never taught about any of those things. So when we have patients that come and ask us about like the decreased libido, the decreased arousal, what do you do for that? I felt like I really wanted to have an understanding and know why, some people experience this decreased arousal, why there's, decreased libido. What if your libido was normal at one point and now it's low? What can you do for that? So I really wanted to be a resource for my patients.
Hello, everyone. I am really excited. We have another phenomenal guest today, Dr. Sadaf Lodhi. I'm just going to give you an opportunity to tell us a little bit about yourself and your journey to medicine.
Absolutely. So my name is Dr. Sadaf Lodhi, and I currently am in New York. I grew up in Michigan, and I am a board certified OBGYN. I became a doctor in 2000. And then I did a 4-year residency in OBGYN in Michigan. And then I got married and moved out to New York. And I currently am not only a gynecologist and OBGYN, but I also am an intimacy coach. So I help women with sexual confidence so that they can find more pleasure in their relationship. And I did coaching through Rutgers University, and I did an extra year with the University of Michigan School of Social Work for sexuality counseling and education.
Those are such amazing things, and we're going to get into all of that. But I want to just start for the students who may be contemplating going into OBGYN and having questions of what they should be doing. Do you have any tips as to what would help someone match into the field?
Yeah. So I think things have changed a little bit more since I applied for residency. But when I applied, there were actually 2 schools. So I'm a DO, and I know that there was the allopathic and osteopathic match. And so I had only applied to the osteopathic match because I'm a DO and because I wanted to further my career in that osteopathic medicine, to be honest. But also there's really no difference in that residency. Now they're starting to incorporate OMM, which is osteopathic manipulative medicine, in the residency. But when I was a resident, they didn't really. And we just did all the same things. So we were catching babies and doing surgeries and all that stuff. And so there was really no difference. I am actually a board examiner also for the DO oral exam so that, residents can become board certified. So I am a board examiner, and I also write for the boards for the DO written exam for OBGYNs. So, yeah.
That's awesome. And I think that you kind of hit it on there, like just finding out like what avenue you want to go into, and then figuring out if you want to only catch babies or if you want to catch babies and do surgery. Yeah. I'm a family physician, so we do a little bit of OB, but not as intense as doing a full OBGYN residency. Yeah. So kudos to you guys.
Yeah. The thing I liked about the reason why I chose OBGYN is because it combines both medicine and surgery. And I wanted something that combined both. I loved my surgical rotation when I was a student. I was like one of those gunners, I would get there at like 6 a.m, not even 6, right? That was considered late. I would get there at 5 a.m. to, do all the rounds before the residents came in because I wanted to look like a superstar med student. And then I would, always ask to go in on all the surgeries, whichever surgery I could go in on, I would try to go in on. And I received one of my best recommendation letters from the surgical resident that I had, the chief at that time. And he wrote me this fantastic evaluation and said, I would make a great surgical resident and I would just love surgery so much. But I also enjoyed medicine, and, OB has tons of medicine in it, especially if you go into high risk maternal fetal medicine. It has tons of medicine where we deal with, complicated pregnancies and so many things, as you know, that can go wrong in OB. And so that's why I loved OB so much, is that it combined both, and that, they always call OB, it's the hurry up and wait specialty, right? So you're always getting, you think the baby's going to come and it's coming, and then you have to wait because then she has to push and all that stuff. But yeah, it's a great specialty if you're looking for something that combines both. And of course, women's health. I was always passionate about women's health. And specifically, I grew up in a little bit of a conservative community, and I just didn't hear the voices of women as much as I wished I did growing up. And so I wanted to be the role model that I never had. And I never saw, a minority woman in a leadership position speaking about, women's sexual health, women's wellness. And I found it to be so important that I wanted to be the voice that I never heard.
I love that. And that brings me to my next question, because you're an intimacy coach.
Yeah.
Can you tell us a little bit about what inspired you to do that and what it entails?
Yeah, so absolutely. So, as a gynecologist, patients would come to me all the time talking to me about like decreased arousal, decreased libido, and what they could do for that. And I don't know if you remember, but I know that in medical school, when I was going to med school, we received maybe like 2 to 3 hours of sexual education and really not much after that. And of course, what we learned was, Masters and Johnson, 1966 research. And, now we're in 2023 and we're still teaching the same thing about, the sexual response. And I just think that, we've moved past that. And so actually now in 2001, Rosemary Basson came up with the female sexual response cycle. And now we're starting to teach that a little bit more. You asked a little bit, why I decided to go into this intimacy coaching. Well, one was patients. Patients want it. Patients, they want us to ask about their sexual health. And I find that a lot of practitioners, due to their own discomfort, don't really address that topic, right? We just don't have the knowledge. I mean, even as an OBGYN in residency, we were never taught about sexual health. We're taught about obstetrics, we're taught about, taking care of babies, we're taught about all the different pathologies that happen in gynecology, but we're never taught about sexual health. We're never taught about pleasure. We're never taught about any of those things. So when we have patients that come and ask us about like the decreased libido, the decreased arousal, what do you do for that? I didn't really have the answers. And so that's why I found it was so important to go ahead and get extra training. And that certification for me was really important because I felt that if I was to, you could always coach your patients and you can, talk to them, but I felt like I really wanted to have an understanding and know why, some people experience this decreased arousal, why there's, decreased libido. What if your libido was normal at one point and now it's low? What can you do for that? So I really wanted to be a resource for my patients. So that was the first thing. The second thing is that, growing up in a community that was pretty conservative, I found that it was just a huge taboo topic, and not just for conservative communities, because I have patients that are, raised Catholic or raised Mormon and things like that. And in those communities as well, right? And Orthodox Jewish people, nobody really talks about this, right? In society in general, we don't talk about sexual health. Sure, what the images we see are, on media or in the magazines, or, perhaps people watch porn and they see that. And then people start to think that, or patients even start to think that this is reality, where we know that porn is really just like theatrics. And we know that, when people that put on porn, or people that are involved in porn, those are actors and that's their job and that's what they do, right? And that's not really what reality is. And so I find that, we just all have like this misconception of what sexual health is. And I just found that it was really important to provide good, solid, evidence-based research out there to the public and to the patients so that they know how to basically help themselves.
I love that. I think that education is so important. And a lot of these topics, like you mentioned, are taboo.
Yeah.
But we have women out there who are not familiar with different ways, the way their body works, the way that they can become more pleasured and things like that. So we have to talk about it, as well as talking about the safety, because you have young women and girls and even men who are coming into the offices and they're not knowing about diseases. They're not knowing about the things and the way that things work. So it's very important to mention those things, because like you said, the patients want us to ask about it, but because it's kind of frowned upon and tabooed in their communities, they may not feel comfortable bringing it up.
Absolutely. I mean, you'd be surprised, and probably you wouldn't be surprised because you're a family doc, is that how many women do not know their bodies, right? Mm-hmm. And they don't realize that they have 3 holes And there is a practitioner that I know of that she actually, during their first visit, will actually give her female patients a mirror so that they can take a look at their vulva and see all the different parts and understand what the vocabulary is, know the language, so that in the future, if they have any issues in their vulvar region, that they can go ahead and ask their practitioner and, say really what's bothering them. So I think that that's really empowering. And that's really my motivation. I mean, I'm on social media and my whole why is to empower and educate women about their sexual health so that they can then have agency over their own reproduction.
I love that. Mentioning this, since we're talking about students, and you were just mentioning how when you were on your surgical rotations in medical school, you're waking up at the crack of dawn and getting there and staying all day. Like, time is not necessarily your own when you're a student and even in residency and so on. So, how would you recommend that medical students approach maintaining intimacy with their partners with their hectic schedules and the stress levels and all of that?
Yeah, no, that is such a fantastic question. And I think it is so important, right, for people. So as we are going through one of the most stressful times in our lives, how do you maintain that intimacy? And definitely medical school is so stressful. So what I would recommend are a few simple things, right? First and foremost is scheduling time. I know that sounds counterintuitive and almost not even like romantic, right? Is to creating that time, but really it is, because when you have such a busy life, when you have such a busy schedule, it's so important to also schedule in time for people that matter the most to you, right? Because we don't really value those relationships because we think that they're always going to be there. And that person, we take them for granted. And so when you schedule in that time for that person, that tells them that they are valued and that they are important and that they matter to you. So I think that scheduling time is so key in a relationship. And that time, I would ask the individual to put away their phones, right? Don't look at it. Just focus on the individual in front of you. And so to be mindful during that time that you have with that person. So maybe it's a few hours, maybe it's 2 hours, maybe you have a special dinner. And what I would do is on the days that I had the exams, after the exam is done, usually people would go out, my colleagues would go out and party or whatever. I would actually take that time to rejuvenate, and I would, schedule like a spa day for me, or just even like just one massage or something like that, something where I can decompress. And that day could also be the day that you reconnect with your spouse or your partner or whoever, so that lets them know that, school is a priority, but also they are a priority. And so they feel wanted and needed. And that only helps to promote that emotional intimacy between you and your partner. And hopefully maybe that leads to some type of physical intimacy, but really creating a connection and a bond with your partner is so important. And you don't have to do anything big, right? It could be literally like just holding hands and walking down the street, or it could be going to a park, or it could be sharing a cuddle or a hug or making dinner together, right? Anything that creates that bond or that connection with you and the other person leads to promoting emotional intimacy, which then, leads to physical intimacy. But I think that just making it a priority and making it so that that person sees that they are important to you is really, really key.
I love those tips because sometimes, especially like as they are transitioning into this new schedule, maybe from the pre med days where they were kind of studying, but not like to the immense aspect as it is in medical school, you kind of get kind of caught up in that, and then
Yeah.
you don't even make time for yourself. So I love
Yeah.
that you mentioned putting yourself first and doing things like spa days or things that you enjoy, and then figuring out that time to connect with your partner.
Yes.
And for those listeners out there, it only gets more intense as we get older. We like to think that it gets easier, but then you'll be in residency on your 24-hour calls, or married or partnered or whatever you would choose to be, or have children. So you add those components on. It's good to kind of create these healthy habits now so that you'll be
Yes.
able to grow them.
Yes, absolutely.
My other question kind of goes back to what you were saying earlier about your patients and how it's important to kind of be that partner with them, because a lot of people don't think about it, but intimacy doesn't only mean sex. Like doctor patient relationships are some of the most intimate relationships out there. Sometimes patients can tell you and reveal things to you that they have not revealed to their best friend or their husband or something like that. So, how can those in healthcare work to strengthen those bonds and relationships with their patients to build trust and have that intimacy where they are comfortable with sharing?
Yeah, so I think you just said it. I mean, really, it's about building that trust, right? It's building that trust with your patient. And I think one of the key things for any type of trust in a relationship is honesty. And I think being honest with your patient, regardless of whatever it's about, showing them that you are always there for them and available for them, right? It doesn't mean that you have to be on call 24/7 for them. It's always good to have healthy boundaries and let patients know that, you're available, let's say, during a business hour from 9 to 5 and stuff like that, but that they can, that there's always a way for them to get in touch with you. And of course, if it's all, if it's an absolute emergency, that the best thing for them to do is go to the ER. But if it's something that's urgent and not emergent, that they can get in touch with you somehow. But I think that making that time and allowing the patients to know that you are there and you're there to be their advocate, I think is so important. So having like open, honest communication with them, being available to them, and allowing them to be open with you, right? So sometimes when patients tell us something, maybe in our heads or something like that, we're thinking, wow, that's really awful, right? Maybe not, showing that in your face, right? Trying to have more of like a poker face or something like that. But I think it's really important to establish that trust through honesty and allowing that patient to be open with you and frank with you, I think is really important. And letting them know that you are not going to judge them, right? I think that's another thing that patients always worry about is that we will judge them or what are we going to think about them if they say something to us. So I think opening up a conversation, for example, when it comes to sexual health, maybe asking them like, are you sexually active? If you are, do you have a partner? Do you not? And not letting, say, whatever judgment we have about whatever it is that they're talking about cloud our judgment, I would say, or our recommendations for them, right? And to be open with them and allow them to be open with us so that there is that two-way communication that happens.
I love that. And I think that you bring up a lot of key points, especially with a lot of conversations going on in the patient community about being an advocate for your patient
Yeah.
and trying to avoid what they're calling medical gaslighting, where you may be dismissive or not really listen to them or let them share their questions or concerns
Yeah.
or be available. So it's important to build those relationships with the patient. So even if you don't understand where they're coming from. It's not about you. It's about the
Yes.
patient and trying to figure
Yes.
out even if you don't know what the next steps are, you say, okay, I'm gonna look into that for you
Yeah.
or let's figure out how to get you to someone who can help you. So that's
Yeah.
very important.
Yeah, I agree with you. I think it's so important to validate, right, your patient's concerns and to let them know that they're being heard. Because I think that that's one of the biggest things that we see now is that, we hear it on the news all the time. We see that when we see the high rates of maternal mortality in the US and how it's increasing, and especially in BIPOC individuals and patients that are minorities, right? In Black and Hispanic and Black and Brown individuals, that the rate of maternal mortality is very high. And why is that? They say it all the time. When you look at those papers and see why the CDC is saying that maternal mortality is so high, it's because patients are not being believed. When they
Yeah.
say that they're having pain, we're dismissing them. When they say they have a headache, perhaps they're postpartum and they're having a headache, and we dismiss that in the ER or we dismiss that on labor and delivery. We say, oh, no, that must just be maybe you didn't drink enough water or maybe, you have a lot of stress or it's a new baby, you're sleep deprived, whatever. Maybe we just need to take a blood pressure and see where that is and make sure that the woman is not preeclamptic, right? It's not dismissing your patient's concerns. And I think that that is what is going to lead to the trust that our patients need and want from us, and that they know that we are actually listening to them, right? And just what you said, medical gaslighting, patients don't want to feel as if their complaints are not important. We need to stop and listen. And I know that we are always so distracted. We're constantly on our phones and we're, not really listening to people. We're trying to multitask, but it's so important, especially when we're dealing with individuals and their lives, that we actually stop and pay attention to what they're saying. And even, like you said, even if we don't understand what they're saying, or even if, we don't completely agree with it, we have to at least let them know that we are listening to what they are saying and that we believe them. And that's the other thing, right? Is that they say that practitioners don't believe patients. And so it's important for us to validate their concerns and let them know that they're being heard, that we hear them, and that we are listening, so that they can be open and honest with us and tell us what's going on. And this is really the only way we're going to bring down the maternal mortality rate here in the US.
I couldn't agree more or say anything better, because you hit on a lot of key points. Like, it doesn't matter what socioeconomic background you come from. We've seen stories like Serena Williams, who
Yes.
was complaining of
Yep.
pain and has all the money in the world, and they didn't listen to her, and she
Correct.
has the PEs. And
Yep.
I've had personal friends who are physicians who weren't listened to, and they have preeclampsia. So
Yep.
just figuring out ways in which you're not dismissing the patients, you're hearing them, you're thinking outside the box. Like, of course, we are following guidelines and evidence-based medicine, but sometimes the patients don't read the book, their bodies. So it's okay to think about other ways and to run a test if necessary, and just be there to listen to your patient.
Yeah, absolutely. Absolutely.
My next question is a favorite of mine for most of my guests, because the answers that come back are so multifaceted and diverse. My question: if you had a magic wand and you could change anything about the healthcare system, because our healthcare system is so perfect,
Yeah.
what would you change?
If I could change anything, I would change the way that physicians are treated. I think that there is, a lot of corporations have now taken over, excuse me, medical practices. And I think that physicians, one of the big things leading to physician burnout is the way that physicians are treated. They're treated as if they're a commodity, as if they are easily replaceable. And that, if it's not working for the corporation, if they're not working, if they're not meeting their financial milestones or whatever that they need to make their revenue goals, then they'll just let them go and hire somebody else. So I think that it would be nice to go back to the times where physicians were actually respected and valued for the value they bring, which is they bring a lot of value to the table. They've spent a third of their life studying, right? Going from undergrad to medical school to residency, and so many years of training and so many years that they've dedicated to serving others, that I think that we only, that they deserve our utmost respect and for the value that they bring to the table. And I think that that's what I would change, is I would give back the physician autonomy to make decisions, and also to give them the respect that they deserve.
That I couldn't agree more on. Like, for the listeners out there, I know that you're very excited to enter the career field, and it's something that is for people who are mission driven and who want to give back. Like, if this is your purpose, this is your purpose. That is wonderful. We are excited that you're joining us at the front lines to serve patients. But I would strongly recommend that you look more into the business side of medicine, because over time, corporate has taken over aspects of medicine, whether or not it be the hospital systems, it be the startup companies with telehealth and everything. So these are all people who are kind of taking over and kind of being the administrative or the business side of medicine, and kind of causing physicians to lose some autonomy.
Yeah.
So it's up to you to know what you're going into, and then figure out which avenue you want to take. If you want to do locums, if you want to create your own startup, because you will be a subject matter expert and you'll be able to contribute in ways that people who are not in medicine will not understand. So you can utilize those skills. Or if you want to do a DPC or a direct primary care practice or a private practice, it's time for people to realize that you are well trained, you are knowledgeable, and you should utilize those perks that you bring to take your place in medicine where you belong and lead the teams that you're already leading.
That's right. That's right. Absolutely. When, physicians absolutely need to be at the head of the table because we are the leaders that are changing medicine. And I think that it's, oftentimes fear gets in the way, right? We're fearful of, what's this person going to say? What's that person going to say? What's that corporate, CEO going to say if I say this or if I stand up for myself or whatever? And it's important to find your voice and know that your voice is very important and that to use it for good. And that you bring lots of value and your training is, not everyone can be a physician. And it's definitely an honor and a privilege to be able to help patients, but you have to understand your own value. And that's, just immense because of all the training that you've gone through and all the sacrifices you've made with family and time and your own life. So it's really important to see your own value.
Absolutely.
Yeah.
You've shared so many words of wisdom, and I'm sure that everyone will be reaching out and trying to look to find you on social media to learn more about your intimacy coaching and your being a subject matter expert in OBGYN. So can you tell us how our listeners can reach out and find you?
Absolutely. So I am on Instagram and TikTok at Dr. Sadaf, DRSADAF, OBGYN. And then I am on YouTube at Dr. Sadaf Intimacy Coach. And I also have my own website at drsadaf.com. I am currently taking telehealth patients in New York and in Michigan, because as you know, with telehealth, you have to have a license in the state that your patient is in. So those are the two states. And then also I am the host of the Muslim Sex Podcast. So it's a podcast where I talk about relationships. I talk about obstetric and gynecology subject matters. And it's really fun. And there's a lot of value in that as well. So I'd love for people to tune into that.
That's awesome. We'll put all of those links in the show notes. And for all of the listeners out there, feel free to click subscribe and let us know if you have any particular topics that you want to hear about or any guests that you want us to invite by going to my Instagram, Dr. DOCTOR, the letter DGRAM, Dr. DGram, or going to Med School Coach at Med School Coach on their Instagram and just kind of sending us a message and letting us know what you want to hear. So we'll be here wherever podcasts are heard, as well as YouTube. So see you guys next week. Bye.
Thank you so much. Bye-bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.